Thank you so much for having me. It's really a privilege to be able to speak with you guys all the way from South Africa. It's actually the first time I'm doing this, so I'm really excited. It's definitely a product that I'm very passionate about. So thank you so much to all of you guys, to SRT, Zishal, and for organizing. Yeah, really glad to be here. So basically, before I start, I just want to say that I'm going to discuss the Tesslift soft as well as the Rhino, and all I'm doing today is discussing my personal experiences. So I'm not necessarily going to go into the technical details. Dr. Kim's covered that beautifully, as well as the other doctors. So I want to just share why I choose Tesslift in my practice. Obviously, it's a very new product in South Africa. I've only been exposed to it this year, but in this short time, it's really become my favorite lifting thread. It really has. For me, when it comes to any aesthetic procedure, safety is always my first concern, and that it takes precedence at all times. And when it comes to threads, obviously we know that there's always a likelihood of bruising and swelling and puckering or dimpling of the skin, especially in the older population groups, which, I mean, those are the target audience that are generally seeking a lift. So we want to know that we're going to get the least complications with the product. And I want to know that when I'm starting with the product. So on this point, obviously, the simplest of facts is the fact that the PDO, polydioxanone, has been around for over 50 years, used in plastic surgery, gynecology, etc. So we know that the material itself is reliable in the tissues. And that's important for me, not to just put something in a person's face that we're not really sure how it's going to react in 10 years' time. So that's super important for me. And I feel much more comfortable using Tesslift for my patients because of that. Secondly, in terms of safety, the round, blunted tip of the Tesslift cannula means that while you're inserting the Tesslift into the SMAS, the tissues are not sliced, but rather moved aside. So this obviously means a lot less bruising and swelling. I've definitely experienced that with my patients. They are a lot happier with the 2 weeks post-procedure in comparison to a lot of other thread procedures. You would definitely expect that a third-generation thread, which would require some sort of complicated technique, and with so many threads on the market, they all require various processes. I love the fact that Tesslift can be used in so many different ways on the face, but always utilizing the same simple technique. Likewise, the ability to use 10 threads on the face, 5 per side to do a full facelift, versus only being able to use 2 or maybe 4 threads for a lower facelift, or just 2 for a brow lift, means that I can literally replace my whole cupboard of lifting threads with only Tesslift. And whichever procedure I need to do, I know that I have a thread available and I know exactly how to place it. I just need to choose my vectors accordingly. That makes a huge difference in terms of, especially if you're a new aesthetic doctor starting out and you're not sure, there's so many options in the market. Now you have one thread, you know exactly how to place it, you can put it anywhere you want, and you know you're going to get a fantastic result. I remember a time when I was actually learning how to use different threads on the market. Everyone having, like I said, its own special methodology, and then facing the patient really not knowing which thread to choose. Is this one going to be better for this tissue? Is that one going to be better? And then once I've chosen, then thinking, oh, okay, what procedure do I need to use for this part of the face? Tesslift really has now become my automatic choice. There is no comparison for me. When performing the procedure itself, I think the most difficult part of any cannula procedure, and this goes for filler use as well as for threads, is always getting that damn cannula through your entry points. I think Tesslift makes it a lot easier because of the tip, the blunted and tapered tip. A lot easier to get your Tesslift cannula into that entry point, which makes ease of use really, really, really good. Similarly, the movement of the cannula, because the cannula is quite rigid, it really does flow quite fluidly through the SMAS. So it really means that you're not having to push, and it really does go nice and fluid. I find I've used threads in the past where the cannula is quite flexible and it can kind of bend. You have to really be quite specific in the way you hold it. This cannula is so nice and firm that there's no worry about the cannula bending on the way in. Furthermore, the diameter of the cannula, so it's quite thick, which obviously people say, you know, in terms of trauma, when I show my patients the cannula, because I always like to show them, this is what I'm putting in your face. They get a bit of a fright because it's quite thick and it's quite long. But the thickness of the diameter is actually great because I find it a lot more difficult to land too superficially in the dermis with the thickness of that cannula. So this means obviously a lot less puckering and dimpling, which is great because that's the thing that patients hate the most. Furthermore, they are really long. Okay, so I love the fact that the cannula as well as the thread inside the cannula is really long. So this means that with one thread, I can lift 2 vectors by using Dr. Kim's reinsertion technique. This often gives double the results that you would normally achieve with the same amount of threads from a different brand. Patients, look, they always want a bang for their buck. So as much as we would love to do a full face lift with 10 threads, 90% of the time, patients can't afford that. They'll often come and they'll talk about the fact that they want their jowls lifted or their nasolabial. And if they can only afford 1 or 2 threads per side, I'm confidently able to give them a good result, because each thread I can get a vector lift in 2 different planes. So the result is massive in comparison to the same amount of threads used from different brands. Then, because of, sorry, if I'm speaking too fast, you must just tell me. I tend to speak very fast. Then, because of the multi-directional or the helical nature of the cogs, the tissue suspension is, I find, unparalleled. That's my opinion. But more importantly, what patients want to know is how long is the thread going to last in the system. So you guys have mentioned already, that PDO threads, if I'm doing a conventional PDO thread, I'll tell my patients, don't expect to lift for longer than 4 to 6 months. If you get to 6 months, you must be grateful, kind of thing. Because we know that obviously the PDO is going to dissolve in the tissues. It's reliable. It dissolves at around 6 to 8 months. The beauty in Tesslift for me is that mesh that surrounds the central core. So the amount of tissue ingrowth that enhances the suspension and also results in a massive surge in collagen production means that I can tell my patients that the results will last up to 2 years. And we've definitely, look, like I said, I haven't had Tesslifts in South Africa for 2 years, but going from everything I've learned from Dr. Kim, I definitely can confidently say that. This 2-year mark, this goes down really well with patients. They're quite happy to hear that, because they don't want to repeat an invasive procedure with bruising and swelling every, twice a year. They're quite happy to know that they're only going to need to do it in 2 years' time. It doesn't matter how, I've definitely found in practice that it doesn't matter how thorough my consent form is or how in-depth the discussion is with the patients. When they have bruising, when they have swelling, there's questions. When there's puckering, there's questions. Even though we definitely allay their fears, they will always have questions about it. The big thing for me is that Tesslift, I've definitely found that there's a lot less puckering and dimpling, but without compromising on the actual lifting capabilities. I believe that this is due to the fact that that the pressure is nice and evenly distributed throughout the thread rather than focused on each and individual cog. So there's not that in-pulling at each cog level. It's really nice and evenly distributed. So the skin is actually quite smooth post-procedure, despite the fact that you've got this beautiful lift. Patients are really, really happy with that. That also helps me open up my target market, because often I would turn a patient away, with poor tissue quality or an older patient, because you can't do a lifting procedure in someone with crepey thin skin. I would, first do a whole bunch of armoring threads or other procedures in order to get that quality better before I would consider lifting. But with Tesslift, I've actually been able to use it without too much excessive pulling on the thread, but to give a gentle lift, because I know that the collagen that's going to form in that mesh is going to armor the skin at the same time. So they're quite happy with that, because they don't have to then wait 6 months for tissue armoring to happen before I can go and put a lifting thread. Okay, now I just want to quickly speak about the rhinoplasty threads, which they have become my absolute favorite in my practice, because noses are very common. I used to do a lot of liquid rhinoplasties, and after I got my first positive aspiration, I got very scared of doing fillers in the nose. I think a lot of us are still scared of it, or we should be at least. The threads are definitely, for me, a safer option, and with even better results, in my opinion, because the specific ND, NC, and NA threads means there's no guesswork. So if I want to fix the nasal dorsum, I put it ND. If I want projection and lifting on the tip, I put it NC. If I want to reduce the width, an NA. One single entry point, and literally an in and out motion, and the nose is transformed in seconds. So for me, in comparison to a lot of other threads I've used in the nose, you need a lot of multiple passes, and very difficult maneuvering within the small little space of the nasal dorsum or the columella, and often you need multiple threads. I know Dr. Kim mentioned you often uses 2 or 3 threads. I've gotten away with using 1 ND, 1 NC, and beautiful results with just 1 of each. Obviously, if a patient has budgets and a worse quality of the nose, we put more. But it's not always necessary. The thickness of that thread means that the volume created is amazing. Also, the strength and the mesh makes that strut in the columella so beautiful that the support created for the nasal tip I find really, really great. Okay. Oh, I actually wanted to mention, just yesterday, it was funny because I was doing Tesslift procedure yesterday, and a patient said to me, you know, it took me longer to prep her and drape her than to actually do the procedure. And that's so true, because these threads are really easy to use, and they, you know, the way that they go in is so quick and easy and beautiful. It really takes longer to clean the patient's face and drape them and make sure that everything's sterile than to actually do the procedure. Once I'm done, they're like, oh, are you finished? Which is great. Also, obviously, injecting with, we use lidocaine here. So I use 1% lidocaine with a little bit of adrenaline in every pathway, as well as the secondary vector. And they find it very comfortable. The lidocaine portion is actually more painful than the procedure itself. The recovery is also a lot better with Tesslift, and I think this has got to do with the fact that it's never really placed intradermally. It's like really, I've never been able to place it intradermally, which is great. But also with the puckering, etc., like I mentioned before, they are really recovering a lot quicker than with some of the other threads. The best for me is, of course, when a patient looks in the mirror after their procedure. You know, the results are, they speak for themselves, and I haven't obviously got before and afters today, but I mean, we've seen some already from Dr. Kim and the other doctors, and really the results speak for themselves. So just in closing, I'm a firm believer really in holding a wide variety of options in my clinic with regards to both fillers and threads to suit the budget of different patients and also to address different needs. But I can confidently say that when it comes to lifting and also so-called nose jobs, I really don't need any other options, because not only are these threads affordable, but they're versatile, and the results and the longevity means that I would be doing my patients a disservice if I didn't offer them Tesslift.